How to sleep with a stomach ulcer. When you're dealing with the pain caused by a stomach ulcer, you might shudder at the mere thought of lying down to sleep. Stomach ulcers occur when the stomach's protective lining is weakened, usually due to excessive NSAID pain reliever use or an H. pylori infection, which allows your stomach acid to cause tissue damage. Fortunately, most ulcers can be healed with a combination of doctor-directed and at-home treatments, so stop suffering and get sleeping. Method 1. Adjusting your sleeping position. Sleep on your back with your head elevated if possible. Keeping your upper body elevated puts gravity to work for you, potentially making it more difficult for stomach acid to reach and irritate your ulcer. Additionally, sleeping on your back reduces the compression of your digestive system, which can also reduce ulcer pain. Unfortunately, depending on the location of your stomach ulcer, sleeping in this position may not necessarily cause a great deal of relief, but it's definitely worth a try. Elevate your head with a wedge pillow, or use wood blocks to raise the head of your bed. Lay on your left side if you're a side sleeper. If sleeping on your back doesn't suit you, opt for sleeping on your left side instead of your right. Because of the layout of your digestive system, staying on your left side may cause less compression and less ulcer pain. As with sleeping on your back, this isn't a guaranteed solution, depending on the location of your stomach ulcer. Don't compress your digestive system by sleeping on your stomach. This is typically the worst sleeping position for a stomach ulcer or other stomach acid-related troubles, such as GERD. If you're naturally a stomach sleeper, try your best to get used to sleeping either on your back or your left side instead. Method 2. Creating a good sleep environment. Cut out caffeine, big meals, and screen time in the evening. Start planning for bedtime several hours before you actually go to bed. Avoid caffeine at or after dinner, and possibly any time after lunch. Don't eat any meals or large snacks within 3 hours of your bedtime, and steer clear of screens like TVs, computers, smartphones, and tablets for at least an hour before bed. The stimulant effect of caffeine counteracts your body's preparation for sleep. Eating before bedtime puts your digestive system to work instead of letting it rest, makes you feel bloated and uncomfortable, and causes excess stomach acid production. Create a consistent bedtime routine so you're ready to sleep. By sticking to a steady routine each night, you can essentially train your body to be ready for sleep. For about 1 hour before going to sleep, complete a series of relaxing, calming activities that signal sleepy time. For instance, you may try taking a warm bath with Epsom salt and up to 20 drops of lavender essential oil. Massaging your feet, legs, arms, and neck, especially while you're in the tub. Make your sleeping area cool, quiet, dark, and comfortable. The more snooze-friendly your sleeping area is, the more likely you'll be to fall asleep and stay asleep despite your discomfort. Try measures like the following. Keep the room as dark as you can. Use blackout curtains and remove light sources such as night lights and bright clock displays from the room. Treat sleep apnea and other sleep disorders with your doctor's help. It's a vicious cycle. Stomach ulcers make it harder to sleep, and not getting enough sleep can make gastrointestinal illnesses, like stomach ulcers, more likely. Since the problems are connected, treat them both at the same time. Along with getting medical treatment for your stomach ulcer, talk to your doctor about diagnostic and treatment options for any sleep disorders you may have. Method 3. Treating your ulcer symptoms. Get a clear diagnosis and treatment plan from your medical provider. Don't just assume you have a stomach ulcer, and definitely don't just wait for it to go away. Instead, visit with your doctor and undergo any tests required for them to reach a diagnosis. Then, discuss which treatment options are appropriate for your condition. The most common symptom of a stomach ulcer is a burning pain in the center of your chest, typically just below your breastbone. Bloating is also a common symptom, while nausea and vomiting are less frequent symptoms. Take 1 or more acid-reducing medications as recommended. Excess stomach acid doesn't cause stomach ulcers, but it does make the painful symptoms worse. Cutting back on your stomach acid should reduce your pain and help promote healing of the ulcer. Common acid-reducing options include antacids, which are over-the-counter, OTC, medicines that neutralize the acid in your stomach. These don't really promote healing of your ulcer, but they can help reduce your ulcer pain. H2 blockers, which reduce the amount of acid secreted into your stomach. These may be prescribed to help reduce discomfort and promote ulcer healing. Take a prescribed antibiotic if you have a bacterial infection. If, and only if, your stomach ulcer is caused by an H. pylori bacterial infection, antibiotics can help reduce your symptoms and heal the ulcer. If your ulcer has another cause, antibiotics will not help. Take any antibiotics exactly as prescribed and for as long as directed. Cut back on NSAID pain relievers if they're causing your ulcer. Stomach ulcers are most caused either by H. pylori infections or frequent use of non-steroidal anti-inflammatory drugs, NSAIDs, such as aspirin and ibuprofen. Therefore, reducing or eliminating NSAID use may promote healing of your ulcer. Your doctor will likely advise you to use a different category of pain reliever. Try aromatherapy with essential oils to ease discomfort. Fill a diffuser with distilled water and a few drops of clove, cinnamon, thyme, or lemon essential oils. As you run the diffuser, take deep breaths so you're able to relax more and smell the oils. You can use aromatherapy throughout the day or even while you're asleep. Identify and avoid foods that cause painful flare-ups. Despite what you may have heard, spicy foods don't cause stomach ulcers, but they can make them feel worse. Different people have different trigger foods that exacerbate their ulcer pain. So your best option is to keep track of what you eat and the severity of your ulcer symptoms. Once you identify foods that cause flare-ups, do your best to limit or completely avoid them. Quit smoking and reduce your alcohol intake. In addition to causing a wide range of other health problems, smoking can increase your stomach acid production and worsen your ulcer symptoms. Alcohol also tends to cause extra stomach acid production and therefore more ulcer pain. Steering clear of both may noticeably reduce your symptoms. If you enjoyed this video, give it a thumbs up and share it with your friends so we can keep making them. For more videos like this, hit the subscribe button and remember to click on the notification bell